It's working. You can hear me, right?
What'd you say?
You can hear me? Perfect. So, ladies and gentlemen, this is Mr. John McLean, everyone. Not diehard John McLean, by the way. Although it could be. You just never know. So John, before we get started, I've known you for, believe it or not, it's going on 10 years. Can you tell the folks who are listening who don't know you or watching on YouTube a little bit about yourself?
Well, okay, that's it. No, okay, so I've been in healthcare in various different roles for roughly 20 years. Yeah, I guess I switched over to healthcare back right before Y2K. So that's 20 years now.
Yep.
And prior to that, I'd spent several years in the United States Army, doing everything from combat arms to working on medical devices.
Okay. And the reason I asked for people, for you to give just a little bit of description or background about yourself, because you and I have talked very recently about what's going on here in America and across the world with COVID-19. So I want to give a little bit of preference or a little bit of background that you have been in the medical industry, and you have a medical background for 20 years plus. You've served your time in the Army.
Yes.
In the Army. So it's not like you're just some educated wackadoo who has these theories and ideas.
No, there is that.
Well,
I'm
that's
not, I'm
fair
not,
too.
I'm not denying that.
But when you and I were having a conversation just a few weeks ago, you were saying some things that maybe I didn't understand or maybe agree with or completely see through what you were talking about. But I think you have a very good point and you raise very thought-provoking questions about what's going on, and maybe an opinion that other people want to hear, or an opinion that other people are actually maybe starting to think about more and more as each day passes.
Okay. So you want me to just jump in kind of on
Man,
what
you
I'm thinking?
just take right off the 20-foot high dive right into the deep end.
Okay. Well, in all fairness for the people listening, and let me give them the warning I gave you before we started.
Yep.
Before I'm done, I should piss off at least everybody that listens for one reason or another.
Well,
If
so
I don't, you don't have a heart that's actually pumping, and you don't need to worry about COVID.
I think there's going to be people who are going to say certain things, and there's going to be half that
Oh,
probably
no,
will go, huh, I didn't think about that. That's a
no,
really good point.
exactly. You're either going to be pissed off because you think I'm a quackadoodle, or you're pissed off because you think I'm right, and you're going to want to dig into it more.
Right.
And really, the people who think I'm a quackadoodle, well, I might be. I'm not going to fight you on that. But
It's fair.
the people who want to dig into it more, I know my theories aren't all correct. If they were all correct, I would be sitting up there in the White House.
That's a scary thought.
It's a very scary thought. I should not have the nuclear football.
No.
But my theories aren't so far off bases that don't deserve additional research by people who are really going to hear it and want to know more about what's really going on behind the scenes. And we'll go through all of that, but the first is kind of an entertaining piece about the virus itself. Everyone's heard the virus came from a wet market in Wuhan, China. And I don't know if I believe that. It's feasible. So I'm not going to say that it didn't, because it's very feasible that it did. But it's also very feasible that it didn't. Think through what this virus is. This virus is extremely contagious, and it's engineered either by nature or a lab to take out the weak among us, the older people, the people with chronic diseases. It's engineered to kill. And the people it doesn't kill, it puts a strain on the healthcare system. If I was to design a biological weapon this would be it.
So do you think that this is something that was designed to do what it's doing?
No, but I wish if I was to design one, that this would be it. No, I actually think this did come from nature. And I want to give the Chinese the benefit of the doubt. I actually do believe it came from a lab, but I don't think it was engineered there. I think it's a pathogen that they discovered through there in China, whatever they were doing. I don't know. Maybe they were eating bats. And they had it in the lab, testing it, trying to figure out how to make a vaccine so that it didn't affect them like SARS did.
Right.
Keep in mind what SARS did to them 15 years ago. And so they're very proactive in SARS type diseases, trying to prevent those from affecting their population in the future.
Mm-hmm.
So I want to believe that what was actually happening was they were in a lab trying to find a solution for this very, very bad natural forming virus. And it escaped. The fact that the virus is highly contagious, much more contagious than anyone has really thought about, and that Stanford paper that came out last week, I'm not going to say proves it, but it definitely puts a light on it. Once that data has been tested in a couple different environments, which they are trying to do they're trying to duplicate that in 5 additional cities right now.
Mm-hmm.
And if that duplicates across 5 different cities, this virus is much more contagious than they've ever thought.
Right. And, to go back to what you were saying about it being in the lab, I think more and more information is coming out that they do believe that this unfortunately came from a lab worker, that he became infected, and not so much from a wet market like was at first initially reported, because the horseshoe bat isn't sold at the particular Wuhan wet market. However, research on the horseshoe bat is being done at, I think, 2 level 4 labs within a few miles to 20 miles of that wet market. Is that right?
There are 2 labs within the area of that market. I don't know the distance. And the changes in a virus that have to occur in order for it to jump from one species to another. And Fauci, which I believe is personally shady, but Fauci did have a point that if you look at the viruses and the track of the virus, it has made the appropriate changes for that to occur, to jump species. So I don't think it was created in a lab for that reason. But on the flip side of that, a virus from a dead bat to a human is a lot more difficult, because viruses need a living organism to grow with.
Mm-hmm.
And yeah, they do sell live animals at some of these wet markets, but a lot of times they're selling dead animals because this is for people's food.
Right.
I don't know if I'd ever eat a bat, but then again, I've not been that desperate. I never lived in a country with a couple billion people.
Right.
But I find it very hard to believe that the virus went from a dead bat to a human.
And let me stop you there for a second, because you said something that's some of those thought-provoking statements you say that leads people to ask the question. You said you think Dr. Fauci is a little shady. Now, what do you mean by that?
I haven't completely figured it out yet, to be perfectly honest with you. There's just a gut feeling about him. And there's been a few things he's done that has started to affirm my thought about him. Like, if you think early on in this whole epidemic, he was up there on stage and people asked him, do you think the American people should wear a mask?
Mm-hmm.
He was asked on the news. He was asked on CNN. He was asked on Fox. It's like he went on a circus and just went around telling everybody the same thing. And his answer was no, it's not going to help people. We need them for healthcare workers. Well, the reality is we did need them for healthcare workers. But that doesn't justify him lying to the American public. Because then a couple weeks later,
mm-hmm.
after they started getting their supplies that they needed for the American people, which they still don't have enough, but they have they have some. All of a sudden, the rules changed. Now, he may have been right initially with it's not going to help the American people. And there is some data that we're going to talk about that will give you a very convincing reason why you should wear a face covering. But, and that may be why he made his change, is he saw
Mhm.
what had happened with this other information. But he's a doctor. Any doctor who has, you know, more than 3 brain cells bouncing around up there know that you wear a mask to keep from spreading what you have to your patient.
True, but do you
Eh,
think he was saying that because at the time when he was making those comments or answering those questions, even the World Health Organization was giving us, unfortunately, what we look back now was wrong information. So he was doing the best with what information he was given. Do you think?
If he's the best that we have in this country, he would have seen through the World Health Organization's information.
And why is it you say that? Like, what do you mean?
Well, we knew that this thing was highly contagious, or we wouldn't have had a White House Corona Task Force before we had it in more than one location. So we already knew it was highly contagious. And as an immunologist, which is what he is, he would have known that the virus was a respiratory virus, and respiratory viruses go from one respiratory system to the other respiratory system. He knew this. Personally, I think he deliberately misled people to prevent people from going to the store and buying up all the supplies of masks so that we could get them for the healthcare workers. He did it with the right intent, but he still did it.
That's just your speculation.
That's I said personally, that's what I think. That's not, there's no facts in that statement, but the timeline works out. There are other things that lead me to believe this about him, but that's the big, most obvious example.
Okay. And do you know how long is Dr. You mentioned something that was interesting too. Like, how long has he been sitting in that position?
He got appointed, I think, by did he get appointed by Reagan? No, maybe the first Bush. He's been in office he's been in that position as director of the NIH since 1984. And to put that in perspective, that was the year before Mitch McConnell was in the Senate.
No, that was the year. That was Reagan's first term, right? Because that was Reagan. Bush was
I think it is too, but I'm gonna Google it right here while we're talking. Who appointed him? But
when the budget allows, I'm going to have an assistant who can Google for us.
well, you got 2 little ones. You just got to let them get a little older.
You don't want them Googling PJ Masks. But at any rate, so yeah, he's been in that position for a long time. And that you were mentioning to me something about how it was curious how he just continued to mention something to the effects of like big pharma and vaccines, something
Well,
to that effect.
he's actually Reagan was who he went in under. His career has been built around. Well, his career's been all over the place, but he's an immunologist, which is basically a vaccine doctor. He specializes in immune systems, but how do we deal with immune systems? We have flu shots.
Mm-hmm.
We have the Hep series. They're all vaccines, and
Right.
they're all pharma driven. And so he does have ties to pharma, and if he didn't, he wouldn't be effective in his position.
And to be fair, those vaccines minus the flu, which they could do better on, but polio, measles, and hepatitis has really helped eradicate a lot of those deadly diseases.
Most definitely, and a vaccine is what we need for this virus too. But the reality is the vaccine is. You and I both know how medicine works. A vaccine's 18 months at best away, unless they skip the phase 3 trials and they start. They get it through the safety trial and they use the American people as the phase 3 trial,
Right.
which honestly, if they can prove it's safe, might not necessarily be a bad idea if this thing was if New York was playing out over and over again around the country. That might actually be a good approach. New York's not playing out over and over again around the country. As we learn more and more about what's going on, I think I have a clue of why Louisiana turned around.
And what is that? What's your clue?
Temperature. So the vaccine, go back to the mask that we were talking about a minute ago. The mask, if you get a mask, put it over your face, and the mask prevents stuff from coming out of my mouth and going into the air.
Mm-hmm.
Well, I was on the New England Journal of Medicine's reading some papers on this the other day, and in a climate control room with no wind, so on and so forth, droplets will travel up to 15 feet away from your mouth through when you're talking. And they will not completely evaporate. And I can't remember the temperature room, but it's like 75 degrees or something like that for 3 hours.
Yeah.
So the virus will stay in those droplets for 3 hours, which essentially means with no disturbance, a 15-foot radius from where you were standing, if you're talking, is going to stay infected for 3 hours.
That's a scary thought. So that means all of Walmart's contaminated and low.
Now, if you're just breathing, it drops it down closer to 6 feet. So the 6-foot rule that they're giving out is very effective as long as you don't talk.
Oh, that's a good point.
Because
but everybody's talking, man.
Everybody's talking. We're Americans. Come on now. Maybe we're talking on the cell phone, or we're talking to somebody. So the 15 or the 6-foot social distancing by the numbers doesn't necessarily work. But keep in mind that is based on, I'm going to have to go back and pull the paper, but I think it was 75-degree climate control, no external forces. I'm sitting on my couch and it's not climate control. I have the air vent blowing down on me right now.
Right.
So there's a current going right here. There's very few places except in a lab where you're going to have that environment. Because there's airflow in every building we're in.
You're saying it's not possible.
In the real world, it's not possible.
6 feet makes people feel comfortable, but it's not possible because people are talking.
Just normal respiration in the real world environment is probably closer to 3 to 4 feet, realistically, because of the other forces. Whereas when you take into consideration talking, 15 feet is in a lab, it's probably closer to, let's just take it half of that and take it down to 7 feet.
Okay.
So a face mask is super effective to prevent the spread of the virus. And if you want to put that into perspective, I'm going to give you a set of numbers just to prove that statement.
So while you're looking at that, let me just be clear for people listening. When you say a face mask, you mean an N95 or KN95, not just a surgical. Okay.
Not absolutely anything you put over your face is going to obstruct the flow. Keep in mind, the study that I was just referring to was referencing a perfect environment with no environmental changes. As soon as you start adding environmental changes, you start blocking it. So doing this is blocking it.
Right.
All you're trying to do is block. I mean, and to prove the whole, because I just did it with my hand and realized it, if I sit here and talk like this, you're going to see glasses fog up.
Sure.
And so that's the micro droplets that they're referring to. The mask is not going to protect me from you.
Right.
The mask is stopping the stuff that's coming out of my mouth.
Right. You're protecting the people around you.
Correct. And so to put that into perspective, a week before the U.S. got its first infection, and I have a timeline somewhere and I could tell you precisely the date, but roughly a week before the U.S. got its first infection.
It was January 20-something, I believe.
Correct. And that's the first date on the Johns Hopkins website. And so I thought it was the same day that This other country got its first infection, but it turned out when I did some more research, they got their first infection like a week prior. Japan had its first patient. Keep in mind that the population density of Japan as a country is much higher than the US
Mm-hmm.
because it's a very small country, smaller than California, but with, I think it's smaller than California, but with 129 million people.
Whoa, because I think California has 40 million.
Right.
And that's the interesting thing about California, because up until, I'll just say a week ago, they had roughly 800 or less deaths.
Correct. So Japan has had the virus in their market for longer than we have.
Right.
It's been spreading for longer than we have. Yet they don't even have 11,000 cases in their country yet.
So wait a minute. They have, we'll call it 140 million, and they have roughly
130.
100 what?
130.
130, sorry. 130 million and 11,000 cases.
Correct.
Do we trust their data?
Japan's pretty reliable with data, but Japan's a very honorable society just by culture.
Right.
And I don't think that they're misleading the World Health Organization's data. But let's just say that the data is wrong by 10x. It's still only 100,000 cases. We have 700,000 cases.
Shit. Yeah.
So even if they're wrong by 10x, we have 7 times the cases and we've had it less time.
Right.
But Japan initially did one thing. Culturally, in the Asian countries, because of SARS and MERS and these other viruses, if you're sick, people wear masks.
Mm-hmm.
And it's to prevent you from spreading your virus to whoever else. And so as soon as the first case was in Japan, they implemented a very strict mask policy. If you're going to be out in common areas, you have to have a mask. You don't have to wear a mask at home, but if you are out on the street, you're in public, if you're in any kind of public area, you have to wear a mask. I'm not saying that worked, but the numbers definitely suggest it.
Were they
Because
social
they're
distancing as
2
well?
months into this, and they have less than 11,000 cases and only have 236 people dead.
236.
236.
And are they social distancing as well?
No, most of Japan is still operational. They did close the schools in Tokyo.
So wait a minute. So their country is still operational. Their economy is still moving. And they have a highly more dense population than us.
Well, so just so you're not looking at any misleading information, because if you go back and you look this information up, you're going to say, well, yeah, but they've got a state of emergency. If you actually go and read their declaration for their state of emergency,
yeah,
the state of emergency they had for Tokyo, because that's where the infections were. And Tokyo has, in Japan, to be qualified for a hospital, you just have to have 20 or more beds. They have a lot of small hospitals. They don't have these mega centers that we have.
I mean, that's some of the outpatient surgery centers around the country.
Correct. So there are articles out there that said, there's one I saw this weekend that talked about an ambulance went to 8 different hospitals before he found a place. If they have 21 beds, it's not surprising.
Right.
Now, of course, they do have some larger hospitals, and I'm not trying to mislead, but they do have a lot of small hospitals. So the article is not complete because it doesn't tell you the size of the hospitals that turn these patients away.
Well, I guess they are turning patients away if they're having to go find other beds.
If they don't have a bed for them, they tell them to take them to another facility.
Gotcha.
Right. But how big is this facility that's turning patients away? They only have 10,000 cases in the country.
Right.
The other thing that the state of emergency did, because they just expanded the state of emergency outside of Tokyo to the entire country. And the reason why they expanded it out to the entire country, if you read it, is so that they can provide financial resources to the rest of the country that is hurting because of the global turndown in the economy. So the economy in the world is tanking, and it's affecting countries indirectly from the virus, or they're being infected. So they had to do a state of emergency so the government could help stabilize the economy.
Okay.
That makes sense?
It does. I mean, yeah, it does make sense. It's just so interesting to me that they have such a dense population, and yet they have so many little cases and so little deaths. You know.
And there's a couple other things that we don't know, and so there's a lot of things about this virus we don't know. One that we don't know. Well, we know we have some insight because of the Stanford paper. How contagious is it really? Stanford implies that it's somewhere between 50 and 80 times more contagious than we initially thought.
So that's something that you did send to me, and I actually looked at that paper and read it. And as even as scary at first glance, when you look at something like that, you go, "Oh shit!" This thing is way more contagious than we ever thought.
But that's
But
actually really good news.
no, well, I was going to say that's good news, because let's just say that you take what's been infected and multiply it by 50, and you look at the deaths that we have, then it's actually way less contagious, or I'm sorry, way less deadly than what we initially thought.
Not only that, is if you take what has been infected in the U.S. and you multiply it by 50, that means 10% of the U.S. society has already been infected.
But don't you think it's a good possibility? And someone brought this up to me the other day, that they think that this virus did not show up in the U.S. just in January. They think that it was here possibly even as early as November, maybe, December. Because think about this. I know, and you probably know, a lot of people during the winter who were very sick and they thought they had the flu. They were sick, running a fever, nasty cough, showing signs of what we would call today of their COVID symptoms. But
Yeah,
they tested negative for the flu.
influenza-like symptoms.
Right, but they tested negative for flu.
Correct.
And they were like, well, what is this thing? And it hung around for about 2, maybe 3 weeks, and then they came out the other side of it.
And back in the fall when that was going on, what was happening, and it actually happened on the West Coast more than on the East Coast, they had a spike in flu-related deaths. And early projections when this virus started showing up, you heard people, and I would be one of them, that said there's going to be more flu deaths this year than there are COVID deaths. And that's because there was such an interesting spike of deaths at the beginning of this year that was abnormal. And the actual number of people back at the beginning. But the flawed portion of that theory, which I do believe that theory is possibly true, but the flaw in that theory is the first documented case, even in China, was, I believe, in December. Now, of course, we trust everything we get from China.
Well, I wanted to say I read or heard something somewhere that the first actual case in China may have been as early as November 17th.
Let me see. I've got the timeline right here.
And while you're looking for that, I will tell people who are listening or watching this, the one thing about you, John, that I do respect is you just don't fly off the cuff with conspiracy theories like, I think this. You actually take the time and research things, and, you do go down a rabbit hole, and I appreciate that, because you want to prove the rabbit hole not to be true. But then sometimes when you do come out of the rabbit hole, you go, you know what? 80% of the shit down here I found out was true.
Right. And it doesn't lead, it won't necessarily lead to this conspiracy theory that I came up with, but it definitely is interesting stuff to know, because it definitely sheds light that the prevailing theory or the prevailing knowledge are what I call, what did I call it earlier? I called them mass media zombies. The people who just believe whatever the media tells them. They just regurgitate what they heard from the media. And I hate to tell it to you, but those guys on the media aren't the brightest people in the world. Some of them are very smart people. I don't know if you know, whatever her name is on the Today Show in the mornings. I mean, she's an attorney. She's a freaking TV show host, so she's not a dummy.
Well, there's a lot of them who are highly educated. I mean, hell, believe it or not, Chris Cuomo went to Yale somehow.
Right. So they're not dummies by no means, but I just think that we have to also keep in mind that they have an agenda.
I was going to say, do you think that they
Oh,
have
I call them the mindless media zombies.
the mindless media zombies? Do you think that they do have an agenda to push? And the reason I say that is because I was just recently watching a clip. I mean, today, as a matter of fact, where look, you can blame him for what's going on or not, but President Trump, like him or not, people are going to say he did a great job. Some people are going to say he didn't do a great job or has not done a great job. But even as recently as the end of February, Nancy Pelosi was telling people to go to Chinatown. She wasn't wearing a mask. They weren't social distancing.
Marching in Chinatown with them.
Do what?
She was marching in Chinatown.
She was marching in Chinatown.
Which
So,
was,
I mean, and she was on a Fox News Sunday with Chris Wallace just yesterday, and she never answered the question when he asked her, "Are you not taking it serious? And were you not taking this serious even towards the end of February when you were marching and going down to Chinatown, not wearing a mask and whatnot?" She totally dodged the question and gave a political answer. But I don't know if the reason I say all that is because I don't know if maybe nobody, our thought leaders and our politicians were taking it serious, or I don't know, because if you're part of a task force and you've been in politics for 30, 40 years, and you guys know we just banned travel coming from China, except for U.S. citizens or what's the other nationalists coming in. Why would you not be wearing a mask? Why would you not be go to Chinatown, but why would you not be taking it serious enough to wear a mask and to do the social distancing? And how can you turn around and say, well, the president or other people aren't taking it serious, and they haven't been since day one? It's just kind of it's hypocritical.
It's peculiar, but you have to understand our political environment, where there's a group of people that if Trump got up on the stand today and said Charmin's a great company, they would not buy toilet paper to save their lives. And he could solve the toilet paper shortages in this country just by getting up there and talking about how great Charmin is.
That's a valid point.
So she was doing that as a sign of opposition to Trump. But in another light, and I'm not going to give her credit for being this smart, because she is not this smart, but it was also a genius move.
How so?
Historically, in this country, when 9/11 happened, there were people who were of Muslim descent around the country who were being jumped and beat up and everything else. They had nothing to do with it.
Right.
Not every American's smart. And they're pissed off, and they're going to take it out of somebody who looks like the person who did it. So by going out there, she showed a sign of unity of America.
Mm-hmm.
That's not her intent. Her intent was to protest Trump, but it also showed that the Chinese American are not the enemy.
Sure.
And we have to remember, in every one of our pissed off bouts that happen, and there'll be more, that at the end of the day, an American's an American. White, black, pink, green, purple, whatever color your skin is. If you're American, you're American. And they all need to be treated the same. And so what she did inadvertently, by accident, is went out and made a statement that let's not blame this group of people.
Right,
because never get credit for that, because she's not smart enough to take advantage of that, but or she would have already done it, because she is crooked enough to have done it. But
sure, but it's interesting too that in the very beginning, there's clips on YouTube and you can see it, to where the mainstream media, all left and right, were calling this the Wuhan virus or the Chinese virus. I mean, it's there. I mean, I know they think we're stupid, but you can go and Google it and you can YouTube it and you can find it. However, now if you say the Chinese coronavirus, you're considered to be racist or whatnot. However,
Because Trump's a racist.
well, but let me ask you this: what do we call the flu of 1918?
You mean the Spanish flu? You,
Right.
the one that's H1N1?
Yeah. And what's MERS? What's MERS stand for?
Middle Eastern Respiratory Syndrome, I think.
Right. So aren't all those diseases racist as well?
They would be, but Trump didn't name them.
Right. So I don't mean to jump off that course, but I just
No. The reality is we have such a huge political divide in this country that everybody, well, not everybody, but a large portion of people are, it's my way or the highway. And if you don't agree with me, you hate people. You're a Nazi. You're a racist. I got told by somebody the other day because I was opposing the lockdown that I hated people. But my opposition to opposing the lockdown is we haven't done a cost benefit analysis of the lockdown.
yeah.
I don't care. We can't say we can't say we've saved 1 million lives.
And the reason we can't say that is why.
The first models were wrong. Now they were right based off the data we had at the time, but once the new data came out, you rerun those models on how infectious it was and how deadly it was. And they didn't rerun the models. They're just standing on, I had this model that said 1.5 million to 2 million people were going to die. And then they'll say social distancing is why we're doing it. But then you have Sweden that didn't social distance at all. And they have 20-some-odd thousand infected, I think, what the number was a minute ago when we looked. I'm sorry, Sweden, 14,000.
14,000. And how many dead in Sweden?
They have a little bit over a 10% death rate. But they made a mistake in there, and I'm not going to defend what they did. And their mistake was they did a voluntary quarantine of people over 70. And if you look at the nomograms for the infections, people over 70, based off of the data that's come out of Spain and Italy,
Yeah.
First of all, you got to keep in mind that unfortunately men have a 66% greater chance of dying from this virus, based off the numbers. Now, as we get larger and larger sums of numbers and we start getting more data, and there'll be a lot of data coming out of the US that will validate or change all these numbers.
So it's not a racist virus. It's actually a sexist virus.
No, it's a virus that takes out the weak.
Right.
And women above age 70, the minimum, have almost a 12% death rate, whereas men have close to a 20% death rate.
And you mentioned something to me about that I thought was very interesting. And why is that?
I've got a lot of theories, and it changes almost daily. Because I find out more information.
The good news is if you have a shit ton of theories, eventually one's going to be right. And you'll say, "Ha! I told you."
I had when I first became a sergeant in the Army, and I got put over a squad, and my platoon sergeant, as we were getting ready to go into a squad briefing for training for a movement, he told me about his theory. Am I allowed to cuss?
Yeah, there's no rules here, dude.
Oh, okay.
The only rule that you and I have is we don't talk about our jobs.
Okay. He told me about the sticky shit theory.
The sticky shit theory?
Sticky shit.
Okay.
The sticky shit theory is if you throw enough shit up against the wall, something's going to stick. And that's what you do. So where he was getting with that was when you go in to brief your team of the problem, you give them the problem, and you give them your second best solution to solve the problem. You don't give them your best solution. And if you have an off the wall solution, you give them that. Because in the Army has a mentality of you're always training people to take your place. So you want them, because if I'm a squad leader and we're in a firefight and I get shot, I don't want my squad to be paralyzed. They need to step up and keep moving. And so you're always that, and in my opinion, any good leader is always preparing the people below him to take their place.
That's a good point.
Because if you're not, what happens, and we talked about this a long time ago, what happens if you accidentally get hit by a bus? The team is broken.
Right.
Somebody needs to be able to step up and do what you do. Even if your tasks are spread amongst a group of people, it has to be stepped up and done, or you've done a disservice. But his theory was, and you saw this many times in the past working with me, sometimes I will come up with an off-the-wall theory, and that's what I'm going to put out there like I'm serious.
That's true.
I know the theory I'm putting out there is off the wall. But using the theory of sticky shit, I'm making you now think why mine is wrong and what could be done better.
And that's a lot of the conversations that you have with people.
Exactly. Why?
But that's what I'm saying. You have a lot of thought provoking. Well, I didn't realize you were giving me the sticky shit theory, but now it makes a whole lot of sense. Wait, 10 years later, now you're telling me what's going on. Thanks. Right. Now I got to peek behind the curtain.
And the reason is, you as a leader, you have to make the decision, but you don't always have the right answer. And the reason why you don't go with your first option that you've already, this is what we're going to do to take that hill.
Yeah.
You give them the alternative, or the batshit crazy alternative. Oddly enough, I batshit from my coronavirus. The reason why you don't use that, you don't give them the main one. You want them to find the flaws in the second theory, so that you, on the fly, can make your primary one better. So when you present the primary one, people are like, yeah, that'll work. You get buy-in just by improving your plan off of their feedback.
God, everything's such a mind fuck.
It is, but it
makes sense. It makes
as smart as anybody is, there's so many moving parts in everything that's going on in society today that you're going to miss something.
So let me ask you this. You had mentioned to me that you feel like we have been mishandling this from pretty much the beginning.
So in 1945, there was this little war going on, World War II. And in World War II, we went and dropped a bomb. 80,000 people up in smoke. 10 to 20,000 people died over the coming weeks and months from damage from that explosion. But it ended World War II. For the most part, there was some other stuff that happened, but for the most part, that's what people remember ended World War II. It's not really what ended it, but it was significantly part of what ended it. So fast forward 50 years, 45 years, and we're now in the desert. Kuwait's been taken. We do an amazing job of stacking tanks and forces along the border, trying to intimidate Iraq to move their forces out of Kuwait, called Desert Shield. Then, all of a sudden, in the middle of the evening, middle of the night there, the American public learns of this great new weapon we have called a cruise missile.
Right.
It's a surgical strike. Yes, there was some collateral damage, but much less than Hiroshima.
Mm-hmm.
So, and I've mispronounced that, I know.
It's okay. I can't pronounce or spell. Everybody knows that.
Right. So why I gave you that analogy is based off the information we had at the time, the only way we could solve the problem in World War II was dropping the bomb. But over the years, we learned more and became more precise in how we conduct warfare, and we came up with much better techniques. We didn't really have any opportunities in battle between there because Korea and Vietnam were such different types of wars that neither one of those would have worked. But And typically the U.S. tries to play by the rules of the Geneva Convention, but not always, but typically, at least in the public's eyes. At the beginning of this, based off the information they had, which we now know wasn't all correct, they did the best they could with the information they had at the time. They took the atomic bomb approach, shut everything down.
Yep.
Because if we shut everything down, we can end the spread. But as time went by, you have to think about collateral damage. You know that extra 10 to 20,000 people that died after Hiroshima from the damage?
Right.
Let's call those people suicide. Let's call those people domestic violence. Let's call those people overdose. Let's call them child abuse.
Yeah.
Let's call them cancers that actually get out of control because they weren't diagnosed, because they're not seeing patients to diagnose right now.
And those are things that are happening literally right now.
Yeah, that's exactly. I'm putting this into, based off of the approach that we took, those are things that are happening. Do I fault them for doing that? No, because based off the information they had at the time, that was the most appropriate method. Where we screwed up is we didn't adjust fire. As we learned that this virus we knew it was much more deadly for the older, but we didn't know we could stratify down and take, if you take people who are under 50,
Mm-hmm.
and under 50, no cardiovascular disease, not diabetic, no respiratory disease, no cancers in their family, you get down to a less than 1% chance of death.
Which is a big deal.
And keep in mind, under 50 is greater than half the U.S. population.
I did not know that.
Yeah, it is. Now, you could not keep everything going. And here's the reason why. First of all, you would have to stratify people based off of their household, because people communicate, or people are close to each other inside the household, and the virus would spread from one person to the next. So if my 97-year-old grandmother lived with me, unfortunately, I would need to be classified as a 97-year-old woman, because if I caught the virus and I was in the same room with her at my house, she would catch it and she would die.
Right.
That's not acceptable. But I live alone. 45-year-old male lives alone. I don't have any of the health conditions that are considered high risk. So by the numbers, I have less than a 1% chance of dying from this virus.
I'll take those odds.
Especially when you start seeing the data coming out that this thing may be 50 to 80 times more contagious, which means the 0.91% chance based off of my stratification from the Italian literature, it's really going to be closer to closer to 0.2%.
When we get finished, if you wouldn't mind, once this thing goes on YouTube or whatnot, if you would be willing, in the comments, post some of the links for people to read, because I think statistics are important, and I think the more we can help educate people and have some thought-provoking conversations and read stuff, because I do think that what you're saying is real. I think the virus is real. I think it's way more contagious than what we think. I do think
real, and it's killing people
100%. But the thing that really started, where I started getting my questions from, so let me just be clear. It's real. People are dying. People are getting infected. And I believe there are some hospitals and healthcare systems that are becoming overwhelmed. However, I am friends with a lot of doctors, ER doctors around the country. And when ER doctors are telling me that their ERs are empty or very slow and they're getting furloughed, what the hell? Because you got people now who have the key skill set to help people, not only help them, but save their lives, who are being sent home because there's no patients. There's no one coming to the hospital. And that's because there's a lot of people scared. They're not coming in. You don't want to go to the hospital anyway because the hospital is a dirty place. We know that 200,000 people a year die because of nosocomial infection. Yes. However, when the frontline people, the heroes, the people that we call heroes, and they are heroes, not me, but those people, they're being sent home, then something's not right. And I'm glad that they're being sent home, which means there's less people who are seriously infected who are dying. So it's a bad thing, but it's a good thing. Does that make sense?
Yeah, no, exactly. And the reality is every life matters.
Yeah.
When I was talking about my 97-year-old grandmother, and if her life matters, especially she's related to me. So if it's your family member or it's you,
100%.
being 1%, a 1% chance is too high.
Sure.
But the reality is there is a such thing as collateral damage. And we are not screening for some things now because those are considered higher risk by bringing the people in to be screened. And we have to come up with a way to balance, because the example I gave to a friend the other day is if we save 10,000 lives by being locked down from the COVID virus, but 15,000 people die from suicide and overdose, did we just kill 5,000 people?
Well, so it's interesting you say that because there is well, I think the off the hip answer is no. But I think if you read an article recently in the New York Post, I think that they were mentioning like during this time, if you die because of suicide or whatnot, you're unemployed, all these different risk factors, you have to mark that up as a COVID death because you wouldn't have done said thing because you would have been at work, you would have had a job.
I disagree. I think you have to.
Well, no, I disagree with that too.
You have to mark it up as a negative to the lives you saved. And what I mean by that is if you're going to do a proper cost benefit analysis, what you're going to do is say, we have the option of path A and path B.
Yep.
We know where we're at in path A, but let's say we continue path A. If we continue path A and we take the real data that we actually know now, not the data that we had back in January, who said it's going to be 2 million deaths. We take the real data and we say that, I'm going to make up some numbers here, that keeping everything closed, we're going to have, or going back to normal life, we're going to have 100,000 people die. It's an easy number to work with. But if we keep everything closed, we're going to have 60,000 die. That's an easy decision to make.
Sure.
There's 40,000 people there.
Right.
But that's not a cost benefit analysis because you have to take into account the other cost of each path.
Right. It's the other 20 to 40,000 people that died because of Hiroshima.
Right. And so the article I think you're referring to talked about if we went up to, I think, 30% unemployment, that it would cost 77,000 lives.
Right.
Just on suicide. And so it's more than normal. So if we take the same numbers we just did, if we take path A, which is one we're on, and we save 40,000 lives from COVID, but we lose 77,000 from suicide, we didn't save a single life. We actually costed more lives. So you have to be able to thread the needle between the two paths to find the path that actually saves the most lives. And I'm going to give you a little stat here from an article I was reading. This article was published in the Tennessee Star back in March 29th. On March 29th, the medical center performed 199 confirmed or suspected suicides from across the region, with 83 of them coming from Knox County. And that was from the previous year. So that would be in 2019.
Yep.
At the time of this article, over the past 48 hours, our examiner has examined 9 suspected suicides, 8 from the county. For the county, that's 10% of last year's total number in 2 days. Those are real people.
No, they are real people, and that's
now, you could use the Darwinism approach and say, well, they were weak, but you could also say same thing with COVID. So you can't just say that all life is we can't have zero deaths, because if you say zero deaths, we might as well go ahead and kill ourselves, because that's not possible.
Not
I mean,
provoking.
I was thinking we could wrap everybody in bubble wrap, but then they would suffocate. So,
Well, I think one of the new norms that we're going to be seeing possibly in our country is more people are going to be working from home. And I think you're going to see more people out in public at Walmart and your grocery stores and your Targets or whatnot wearing masks.
and the thing you're going to have the most fun with after about 6 or 9 months is you're going to be out with your friends at a restaurant, and you're just going to go to clear your throat and watch the people scatter.
For sure. I mean, you do it now. You walk around like.
Oh, I know. I actually did sneeze because of allergies in the grocery store the other day, and I saw like 4 people turn around and go the opposite direction.
Well, I think this is going to become our new norm, because. So I think one of the ways to help prevent this, or to help prevent you, myself, and other people acquire this, was a good ER doctor friend of mine sent me a YouTube video from Dr. I got it right here, Dr. David Price, and I believe he is a pulmonary cardiologist up in New York. And he has a long, like 50-minute, 60-minute YouTube video. But if you listen from minute 7 to 14, and I would recommend anybody who's listening or watching tonight, just listen from minutes 7 to 14, and it's called "Protecting Your Family from COVID-19" by Dr. David Price on YouTube. And basically, what he tells you is,
Okay.
and this is a doctor who works with COVID positive patients every day. Become a hand Nazi. If you're going to go out into public, wear the mask. If you're going to go to the grocery store, wear gloves. But when you are aware of your surroundings, and it's hard because I've noticed myself touching my face multiple times during our discussion, like you're doing right now. Stop touching your face. Don't touch your eyes, your nose, or your mouth, because those are the 3 major pathways for infection, or to get contaminated. Wash your hands, go out in public, wear your mask, wear your gloves, and keep a bottle of Purell, if you can find any, in your pocket. And when you touch something, use hand sanitizer and don't touch your face. And he is now to a point to where he feels very confident that he is not going to get infected because he is using the appropriate PPE, yes. But when he's away from the hospital setting, he's practicing being a hand Nazi, washing your hands and stop touching your face. Like, I'm even trying to incorporate it in my 3-year-old twins.
That's just good. I mean, the touching your face thing, I mean,
it's good practice.
It's kind of part of how we are, but it's with your twins is the time to actually implement it. We're going to have a very hard time implementing that in society, but washing your hands. So COVID was just hitting the US. People were I started seeing, I had to fly to Austin for work. And
but to stop real quick, next time you go to a men's restroom and you hear somebody taking a noisy Dumb and Dumber shit right beside you, he gets out of the John and he leaves and doesn't wash his hands.
That's exactly where I was going. So I just got off a plane, and 3 or 4 people in there had N95 mask on. So one guy had this thing that looked like he was from some World War II bomb shelter. And I go to the restroom after I get off the plane, and I'm washing my hands, and I counted 5 people walk out of the restroom from behind me without stopping to wash their hands. Not even sprinkle water on them. I'm not talking about scrubbing them, not even sprinkling water.
But I think that brings you to the point, like, I hate to interrupt you, but this is driving me crazy. So we know it's here. People are wearing a mask. People are taking precautions. And you got some assholes who are doing their business in the bathroom and they're not washing their hands.
But you also got to keep in mind, that when this was going on, you had some politicians saying it's not real when you had others saying it was.
That's true.
So depending on which side of the aisle you fall, really kind of depends on what you believe, because those mindless media zombies, whatever those pundits on the channel that they like, whether it's CNN or Fox, whatever they say, they go with.
No, it's true. Yes.
And unfortunately, there is not a media agency that I'm aware of that isn't pushing some sort of agenda.
Right.
And it's not necessarily, I don't think on the major networks, the NBC, ABC, those networks, I don't think it's as blatant. And I think the agenda is more the agenda of the individual anchors versus CNN is very left wing and Fox is very right wing. I think the major networks at least try to appear like they're not, but they're very liberal.
Let me there. I would just, if I may, I will tell you, if you don't start watching ABC World News at 6 o'clock, and you will see.
I don't really watch ABC at all, but
You should start, because you will start to see they put their spin, their perspective on it, 100% for sure.
well, and you got to keep in mind that they've got their spin, their perspective, but the facts are the facts, and just because they're showing you something or telling you something doesn't mean it's accurate. And I sent you a picture earlier today. I don't know if you saw that email with a picture in it. And I sent that for a reason. Let me go to the sent. Well, I think I have it here in a Word document.
But while you're looking at that, I want to say something. But like, listen, you and I and every American sits around their boob tube at night and they're watching CNN, CBS, Fox, AB, whatever the network is. But they're expecting to see the facts. Okay, they're not expecting to see opinions. But what we're being fed is an opinion.
No, we're being fed the facts with a spin
to fit an agenda or a narrative or how that specific network wants to look at it. And that's why I try my best to be open enough to where, yes, I watch Fox News. I also try on Sundays to look at Sunday mornings, Meet the Press and Chuck Todd. I try to look at it, and then it's almost like somewhere in the middle, maybe there's a truth, but it's interesting to see everyone's spin on. And the other interesting thing too is it feels like everyone in the mainstream media is working on this title, which is clickbait. So we'll click on it, and it's fear, and it's trying to scare people, and they don't care if it's not true. Maybe there's a little truth to it, but as long as you click on it, like for example, the Elon Musk situation, to where I believe it was CNN said Elon Musk said that Tesla was going to deliver ventilators to California, and CNN said he didn't come through with his promise. I'm paraphrasing, so please, people, Google it, look it up, or whatever. But Tesla actually came through and created BiPAP and CPAP machines, which technically are ventilators, but they're not internal ventilators, where you put someone with the ET tube, they're totally ventilated, they're totally intubated, and they're put on a respirator, which is there to artificially breathe for them. Right. But what they did was, what Elon Musk and Tesla did was fulfill an order as to what they were told was needed. And then he got slammed by CNN because they said Elon Musk and Tesla didn't do it. So he challenged them and actually asked the governor of California, Gavin Newsom, is it Gavin Newstead or Newsom?
Newsom, I
think. To back him up. And I believe that he did, because if you tell me you need 20 tomatoes and I deliver you 20 tomatoes, but you said you really needed 20 whatever a shadow vegetable root is, then don't blame me for not delivering something else. I delivered what I was told to deliver. And that was a long rant, sorry.
No. And it's perfectly fine. And I want to get to the ripple effect of all this, but what you see, and it's kind of a funny, it's got Wolf Blitzer on one, and then it's got this, what I can't even think the other guy's name on the second picture. But on picture one, it says Trump should have used his powers to force all the states to shut down on Sunday. But then on Monday, they're saying Trump doesn't have the political force the states to open. And
I have it right here. Yes. And
this is not just, this is just very easy because it's very easy because Trump is very polarizing.
Sure.
But if you go to the other side of the thing, I can probably put together the same pictures for Fox News pundits on Pelosi. Except Pelosi, I'm not a fan of her.
I don't know. That might be hard to do.
But
I mean, so to be fair, and I want to read this to people so they can see it that you sent me. It says on Sunday, this is Wolf Blitzer, and the caption at the bottom says, "Breaking news: Trump killed people because of his late actions. Trump should have used his powers to force all of the states to shut down." The next night on Monday, with Anderson Cooper says, "Trump will kill because of his actions," and it reads, "Trump doesn't have the power to force all the states to open." And I think that's the problem. Like, that's the crux of the matter for what we're sitting here trying to listen and understand from the TV. What is real, man? What is going on? Because you can tell me one night that person X is to blame because he should have done. And then literally 24 hours later, you're saying person X doesn't have the authority to do this and people are going to die. Insert president, whoever.
And luckily right now, we have this amazing opportunity to educate ourselves because we're all sitting at home.
Right.
You can actually look and read the real stuff. One of those links I sent you today was the actual Constitution.
Yeah, and so I want to ask you, you sent that to me because why?
Well, so the way these orders are written and the way they're being executed, perfect example is, well, before we get there, let's get down to the facts of what's really going on. In North Carolina, I have a chart because I've recorded every single day how many patients there are in the hospital, how many are infected, and everything else. The absolute most number of patients we've had in the hospital in North Carolina was actually on Sunday's report at 465 patients in the hospital. So in the state of North Carolina, we've had 465 COVID patients in the hospital.
And where do you find this? And again, this is why I wanted to have you on here to talk about this, because you do the research, you look at it, you find this.
Correct. Well, it's out there. If you go to ncdhhs.gov, that's the North Carolina Department for Health and Human Services.
Yeah.
They put it on their website every single day. They update it every single day at 11 o'clock.
So every single day you can look, anybody can go and search this and see what you're talking about.
Correct. I mean, I'm on the site right now, and I can go as far as to tell you in Iredell County that you have 82 cases confirmed by a lab with 2 deaths. As of, actually they updated at 10:35 this morning. As of 10:35 this morning. But in the state, we've never had more than 465 cases. Now, why does that number matter? Because, and it goes to the point you were making earlier. They also report how many empty hospital beds we have. Now, the empty hospital beds on here is not accurate. First and foremost, let me tell you, it's not accurate, and they'll admit to it not being accurate. Well, there is a level of inaccuracy here from facilities that haven't reported. So they can only tell you what they can tell you based off of who's reported the information.
Okay.
But they're being transparent with what they have. But right now, or as of 10:35 this morning, there was 7,245 empty hospital beds in the state of North Carolina. There was 889 empty ICU beds. So we literally had enough ICU beds for 100% of the patients in the hospital to be in there twice.
I've got to pee. I've been drinking like 3 gallons of water. Tell people that stat. Tell the folks that stat while I go pee. I'll be right back. Say that again, because that's important to know, because again, that goes back to what I was saying earlier about people nurses and doctors being told to stay home and not getting paid.
Correct. And the nurses and doctors and medical assistants, it's thousands of jobs, but it's because the non-essential procedures have been put off because of this tsunami of patients that is supposed to be coming. We're supposed to have this tidal wave. We don't want to overwork the system. And in parts of the country, that happened. It happened in New York, and I'm not denying it did. And people died for no other reason than they didn't have the enough care to take care of them. The death toll in New York would not have been as high as it was if they would have had the resources. I'm not denying that. The same thing happened in Spain. The same thing happened in Italy. But that's not the reality everywhere in the country. Houston, I was talking to somebody earlier today in Houston who has Houston healthcare workers are stressed. There's a lot of cases. It's the highest cases in the state of Texas. And that's putting a strain on their system. But that's not the whole story. Because in that same city, I know healthcare workers that are out of work because they didn't work in the hospital. And they worked in a surgery center or a doctor's office or wherever else. And they were sent home without pay to not work because they're closing the center that they work at, whether it's a gastric center or whatever it is, until the end of April. They didn't furlough them. They didn't lay them off. They sent them home because they weren't doing procedures. So they are essentially at home without pay and cannot even apply for the unemployment.
So they don't qualify for the unemployment?
No, because they're still employed.
Gotcha. And the other drawback to that is too, John, is so these folks who are being sent home or whatnot are having to use their PTO, and they don't have unlimited PTO.
Correct. Well, some of them aren't even going to be the ones who are being furloughed aren't even being allowed that.
Right. So, so some people who are working in the emergency department or wherever, or outpatient surgery or whatnot, if they're told not to come in, they have to use they can choose to either not get paid or they can use their PTO. But eventually that PTO is going to run out.
Correct.
Especially if this thing extends into May, June, who knows?
Correct. Exactly. So why does it matter that we're not straining our healthcare system? That sounds like a good thing on the surface.
Right.
Except we have millions of people. We have the governor, whatever his name is, said the other day we had over 500 X many thousand people newly unemployed in the state of North Carolina. We only have 10.5 million people in the state. So we have a legitimate increase of unemployment by, what is that? Not 5% increase in unemployment in like 2 weeks. There's a problem there, especially when some of those unemployed are healthcare workers who are the reason why we're unemploying people. We're not unemploying people to save lives.
Right.
Don't misconstrue. We're not staying home to save lives. We're staying home to not strain the healthcare system. Because if we strain the healthcare system, then people die. But when the healthcare system is laying people off, it's not strained.
So one of the things that I've always, I'm kind of scratching my head about now is I was in the emergency department during the swine flu.
Correct.
And the swine flu infected over 60 million.
We were working together at that time.
Well, so it started in 2009, and you and I worked together in 2010.
Okay.
So I was still in the emergency department, and here's the thing that I can't really wrap my head around is because we had 60 million Americans diagnosed and 12,000 and change died. A lot of deaths. But there was never this urgency or outcry. The stock market wasn't tanking. Unemployment. The response was different.
Well, there's several
level of fear and panic. Do what?
Several things are different. First of all, this is not the flu. It is more contagious than the flu.
Absolutely, without a doubt.
Is it necessarily worse than the flu? Only time will tell us the answer to that question. The reason why this is so bad is not necessarily because it is actually more deadly than the flu.
Yeah.
It's so bad because it overwhelms your healthcare system. Like I said earlier, if I was to design a biological weapon, this is the perfect thing. It has a long gestation period before you have your first symptoms.
Yeah.
It's hyper contagious during that time. So one person can infect potentially 100 people in the time before he has his first sniffle. And then only a portion of the people, let's say 10% of the people, ever get sick enough to even get tested. So you never know how many are infected. And then less than 5% end up in the hospital. 5% doesn't seem like a lot until you're able to hit an entire population.
Right.
5% of a population, or 1% of the US population would overwhelm our system. And once you overwhelm the system, people die
Right.
because they can't get the care they need. In Italy, people were sitting on gurneys in the hallway
Right.
because they didn't have rooms, they didn't have ventilators, they didn't have anything. That's why people died. They didn't have the healthcare, and they've got a good healthcare system in Italy.
Well, the standard, the gold standard of anesthesia actually comes out of Italy.
Yeah, it's a good healthcare system,
Yeah.
but it's not one that can take 50,000 people into the system in a period of days.
Right.
And I don't know what the number is. I'm throwing out numbers right now, but that's the problem that happened, and that's the reason this virus is deadly, is because it can overwhelm the system. So I don't fault the leaders for taking and doing a bomb approach.
Mm-hmm.
But as we get more data, that's when you can learn that you can start loosening the reins, start working towards a vaccine approach. The reason why we vaccine people around in the country is so that we can build herd immunity at a rapid pace. The purpose of herd immunity is so that if you have an immune disorder and you cannot afford to catch a virus, we want to make sure we put as many people around you as possible who is immune to it. By making all of them immune to it, you're less likely going to catch it. That's the herd immunity theory, and it's a valid theory because that's the whole basis behind vaccination.
Yeah.
Is to protect the people who can't be vaccinated, or in our country's sake, the people who won't get vaccinated because they're anti-vaxxers. But it's to protect, but you have to have a minimum of 70% of the population has to be immune before the herd immunity actually works. So once we learned who are the people who are going to get sick and die, we don't know who the people who are not going to get sick and die, but we know who has got a very high risk of going to die. We should have started testing the waters with the people who wouldn't. Unfortunately, we have a lot of teachers who are overweight. We have a lot of teachers with diabetes, high blood pressure. So we could not keep the schools open because we wouldn't have had enough teachers, because those teachers would have had these problems.
And to be fair, I think 45% of the American population is obese, period.
We are a very unhealthy society, which is what's also played into why Japan is doing so much better. It's not just the mask. That's why I gave you the 10x. It could be 10x worse, but 10x worse is still not anywhere near where we're at. 20x is nowhere near where we're at.
Right.
So you have to take the whole picture. You have to look at everything that's in there. And back to the cost benefit analysis, you have to do an entire cost, because you have to say this we're accomplishing this by doing this. And to put it into very clear, because I just thought of it, a very famous thing that happened in American history, and it's very sad that it happened, but everyone knows what it is. Sherman's March. It was determined, it was to break the back of the South, where he marched from Atlanta to the coast, burning every house and killing everybody. It was to break the hearts and minds of the South. Was it okay? It accomplished the intent was there, and he accomplished his goal, but was the means worth the end? And because all those lives that were lost during Sherman's March, there were women and children.
Right.
That's not okay. And we have to think through the approach that we're doing. And as we get more data and we learn, we need to adjust. And if they have to adjust their approach every single day, adjust their approach every single day. But be honest with the American people and tell us, this is what we've learned today, and this is how we're adjusting fire. We're not a stupid country. We're some of the brightest people in the history of the world in this country. Now, we have some dumb people too, but we have the brightest people in the history of the world in this country today. If you're honest with us and tell us all the facts, we're probably all going to come to the same conclusion, as long as Trump doesn't say it. But that's very truthful. And so we have to make sure that we're moving in one direction and we're not fighting at each other, because right now we have half the population stay at home and they're rowing this way. And then you have the other half of the population, no, go to work, and they're rowing this way. Right. We're both in a circle. We're not going to go anywhere. And do we need tests? Yes, we need tests. Yes, we need masks. Yes, we need all this stuff. But should we stop moving forward to acquire the stuff, or should we come up with a plan to acquire it while we're moving forward? I mean, it's like a Marine being in Vietnam saying, I'm not going to take that hill until I have an MRE. But the MREs are 2 blocks up that way. But I'm not moving. God damn it, they're going to bring those MREs to me, or I'm not going to take that hill. He's going to get shot. And that's what the problem is we are so bit and determined that our way is right 100%, and we're unwilling to compromise. So
maybe a Army Marine thing, but I just want to let you know that I love all the Army, Navy, Air Force, and Marines and Coast Guard and everything else, and National Guard. Thank you for what you do, because I'm not man enough to do any of it.
Okay, so I'm former Army, and I will have to say, if there is any Marines listening, I joke about Marines being sponges, and they're bullet sponges. And that's because Marines, God bless them, are some tough motherfuckers.
Yeah.
That is almost a term of endearment for me, because they are the ones who take the beach first. The Army comes in and holds it, but the Marines are ones who go in there and take the bullets. And so it's out of respect that I know what they're doing. My father was a Marine, and I don't hate Marines. Now the Chair Force and the Navy, that's a whole nother story. But the Marines I have a lot of respect for. I have respect for the other guys too, but and then I just use a Marine as an example in that thing. But what we have to be careful with now is we took this massive approach, and in the approach that we took, we crossed some lines, and the lines we crossed.
What I want to get you to. Go ahead.
So. Back to Sherman. Sherman accomplished what he was after, but he crossed some lines. But in the eyes of America, he's a hero. We named a tank after him.
That's true.
Okay? So we would not name a tank after him if he wasn't someone that's a sign of honor. So but what he did was horrible. But we have a set of laws in this country. And these laws all come from the same document, the Constitution. And unfortunately, everything we do is based off the Constitution. And that is hard for some people to understand.
Right.
And even the governor, in his stay-at-home order, everyone has to stay at home. You can't assemble. You can't go to church. I mean, he deliberately said, don't go to church.
Yes.
Don't assemble in greater than 10 people. Well, no, don't gather in groups of greater. He did not use the word assemble deliberately, because that is a constitutional violation. And so it's okay to quarantine somebody by the laws of this land. You're able to take somebody's constitutional rights away to quarantine for the greater good.
And that's what they're doing now, is what you're saying.
No. That's been proved. That's if you go through and you read all the case law, and that has been done, and it's been challenged in the Supreme Court, and that is all right. But the burden of proof that you are causing
they have to be able to prove that you're infectious. If they don't know that you're infectious because they don't have enough tests, doesn't mean they can take your rights away.
But that's what they're doing at the
That's
moment.
what they're doing. They're saying, well, yeah, but you might be contagious and you might spread it to somebody else.
But isn't this situation kind of like for the greater good? Let's say that they're taking our rights away by quarantining us, or saying we can't gather more than 10. You can't go to church. You can't do whatever.
Okay.
Just touch my face. Everybody at home, don't touch your face. But let's say that I own property up here on a highway, and they want to create a shopping mall or whatever, but they want to take 17 feet of my property. As long as they deem the government or the state government deems it for the greater good, they can take my house,
Absolutely
my
not.
front yard.
Absolutely not. They have to give you fair market value for it.
Well, they give me it's their fair market value.
They cannot take property from you without paying you for it.
But if I say no,
they can take it to court. They can ultimately take it. They will be able to take it.
That's my point. If they tell me my front yard is worth $1,700, but I say my front yard is priceless, it's my front yard, and they go, well, it's for the
they're going to take it to court, and they're going to come up with an evaluation. In that same scenario, though, when you go to court, if the court case is you're saying it's $40 and they're saying it's $17, now the case is completely different because now it's a matter of proving who is right. But if you're saying it's priceless because it's my front yard, unfortunately, everything has a price.
Right. But at the end of the day,
now
I'm going to lose. And most
what did we just point out is we pointed out a very important, crucial step in the process, though. They're going to take your front yard by taking you to court.
Right.
The 14th Amendment allows due process. In order to quarantine somebody, you have to go through due process. You have to prove that they're contagious. You have to prove they're a danger to society. These are things you have to prove. They have not proven these things. And how do we know that? Because the models were wrong.
Their initial models
were wrong. And all along, the models keep changing, and they say, oh, it's because we're social distancing. We're social distancing. Okay, then explain Sweden. Or explain Japan.
An hour and 30 minutes, we get to the meat and potatoes.
Explain Mexico. Explain Mexico. It's a correlation. We have a correlation between everybody staying home and there being a drop in numbers. But we don't even have a correlation yet because we don't know if the initial numbers were correct.
So I want to ask you something about, you mentioned Mexico and the temperature earlier, and I'm sorry I missed it.
We kind of went on a tangent there. So the reason why the temperature matters there is as the temperature goes up, what happens to water? It evaporates.
Right.
So the droplets that come out of your mouth at a higher temperature are going to evaporate at a higher rate. Once the droplets have evaporated, the virus dies. The virus itself is just as contagious in the hot weather as it is in the cold weather. It just doesn't have a vehicle to transport it. So the transportation vehicle, the water molecule, the bus, gets a flat tire, and it doesn't make it to the next person. That's why in the summer months, the flu goes away. The cold goes away because it doesn't have that transportation to go from person to person. That makes sense?
It does make sense, but even in hotter climate countries like the Caribbean and places like that, they do see the coronavirus. So is it people who traveled to places and came back?
We still see the cold in the middle of summer too. It's still here.
Right.
It's just not as contagious.
I got you. That makes sense.
And in some places, and I'm not going to name any countries just because I will actually get called racist for this one, but in some countries, hygiene is not the same as it is here. And
to be fair, I know a lot of people in this country who are some dirty son bitches.
That is very true.
Right.
Just walk around some of these all-natural food stores.
That's a fair point.
There's a benefit to a mask. But so because they don't wash, they don't bathe, they don't wash, they become magnets for viruses, and so the virus will spread easier through the population because of their hygiene. But that's not the norm along the equator.
Mm-hmm.
And it has to do, we still have colds here in the summertime. I've had summer colds and they're miserable.
Sure.
It's hot.
Summer
I'm-
cold is the fucking worst.
It's because it's hot. And
Right.
it's but I'm less contagious. Because the only way I'm contagious, if I go to work with a cold in the summer, there's a good chance everybody I work with is going to get sick.
Yep. I have been labeled at my job as the healthiest, sickest person they've ever met.
There you go. But if we were to go out to a football game together, the chances of you getting in front of me go down dramatically because it's 90 degrees out there.
Right.
And those droplets aren't going to make it from me to you. So all those things have to be taken into account when you're thinking about the spread and all that. That's why you're going to see the spread slow down. Now, I personally hypothesize that the children are dealing with this virus much better because children of school age have a much higher immune system. And why is that?
Well, they're
Because
around
we
all those other little.
pack them up every day and we take them to these public petri dishes so that they can get viruses and they get infected with something and exposed to something almost every day.
Yes.
And so their immune systems are ramped. They're ready to take on the next thing because
They bring those little viruses home to their parents, and they get their parents sick. Almost lost a testicle because of that. That's another story.
And sometimes they don't even bring it home because their immune system is so ramped that they come in contact with it, and they've already seen that one before, so they're not bringing that one home. So that's just my own personal hypothesis. There's no science behind that at all, other than just jumping to huge conclusions. But back to the topic of the stay-at-home order. So what happened in the stay-at-home order is they've literally said you can't gather. Well, and all you can do is essential activity. So they've essentially jailed you without due process. And they've taken your rights away. Now, they could still accomplish the same thing without breaking rights. And Mecklenburg County, your friends to the south, they closed all the county parking lots to the county parks because people were going there and playing volleyball or playing basketball or whatever else. But the data shows that the population who is out there playing basketball, although when you look at the numbers, and I'll give you the numbers right here from the state's website, you have 47% of the people infected in the state of North Carolina are under age 50. 47%.
Shit.
And of that 47%, 39% is 25 to 49. Of that 39% represents 4% of the deaths in the state. 85% of the deaths in the state are from the 65 plus age group, which only represents 25% of the infections.
That have been tested.
Say again?
That have been tested.
This is all laboratory confirmed. And they do have a little bullet point here that they have 4 laboratory confirmed cases that are not stratified because they have the age missing on the paperwork. That's not going to adjust the numbers when you're dealing with 6,000. But so they closed the ability for people to go to. You can go to the park if you can walk there, but there's a lot of people who are not fortunate enough to live close enough to a park where that's reasonable.
Right.
So they deliberately made parks unavailable to the less fortunate. Now, you can be on whatever side of the aisle you want. The less fortunate doesn't have to be poor. Because I don't live near a park, and I live in one of the nicest neighborhoods in the city.
Right. Fair.
So,
because you live in Charlotte, by the way.
yes, I live. If you're familiar with Charlotte, I live a block away from South Park Mall. So I don't have a park near me. The closest park near me is like 3-4 miles away. I'm not going to walk there so I can exercise. Getting there is going to be the exercise. I mean, seriously.
Yeah, but you're an ex-Ironman guy, so that's like nothing for you. So
Yeah, well, that's back when I was healthy. But they did this without the data to justify it. Their justification is, yeah, but if you get it, you're going to spread it.
right.
I'm sorry, but there's nobody else in my house for me to spread it to. Unless, and if they are here and I spread it to them, they deserve to get it because they're probably going to get a bullet next. Okay, because they're not supposed to be here.
Right.
So how am I going to spread it? So that their justification is flawed. So the due process would never work. That's why they haven't tried it in court. And there are attorneys in the state who are looking to challenge this. In fact, there was a demand letter, and I haven't had the chance to go look at it, a demand letter sent to the governor on Saturday. It was delivered to the governor on Saturday, and he had to respond by today. And it had to do with clarification of the stay-at-home order. And had more to do with last week they had a protest in Raleigh, and a protester got arrested because the Raleigh police verbatim, even on social media, said protesting is not essential activity.
But only one person was arrested. I think it was a lady, right?
Yeah, well, the rest of them dispersed.
Yeah.
But there's nowhere in the Constitution that says if there's a pandemic, your rights are gone. Abraham Lincoln tried to get around the Constitution when they were at war. We had Americans shooting Americans, and the Supreme Court upheld the Constitution.
And I think that's one of the things.
You cannot tell.
Finish your statement, because that's what's important. Go ahead.
Yeah. So you cannot tell me that this virus is more deadly than 100,000 troops staring you down with bullets.
Right.
If the Supreme Court wouldn't allow people to be confined and take their rights away without due process back then, when people were shooting each other, really? Come on.
We're talking like
we have an invisible enemy that we don't know who has it.
Right. So, John, before we wrap things up, I want to ask you, you had told me that you had actually either emailed or you had sent a tweet to major media outlets, and you had asked some really good questions. Can you pull that up? Do you have the time to pull that up?
I'm doing it daily.
I know you are.
Do you remember any of them?
It was like the top 8 questions that you had at the time. And this was like maybe last Wednesday, Thursday. And you were asking me these things. And I was like, shit, dude, what you're asking me, I don't know the answer. They sound like legitimate questions that should be asked. And let's just do a podcast and talk about it.
So what I can do is I can just give you some of the basic questions that I've been asking.
Yeah.
I'll give you a blatant one. Why is the number that is reported by Mecklenburg County different than the number that the state's reporting for Mecklenburg County?
So, whoa, wait a minute. So what you're say that again?
The number that Mecklenburg County reports for the virus, how many people were infected, how many people died, does not match the same number reported by the state for the county.
Well, that should be a number that is synchronous. Like they should be in sync with one another.
They should be. Now, they're not hugely off by no means, but they may be 20 or 30 patients off.
Well, that's a lot. I mean, that can overwhelm a hospital.
Not when you have 2,000 beds, but yes, it could.
A small hospital, like let's say Huntersville, it could overwhelm them.
Oh, yeah, it definitely could. And that's part of the whole picture. But the other is Charlotte came out with a model that they used at the University of, I think it's Pennsylvania's model to figure out when we're going to peak. And they came out with, and last week they said, well, Charlotte's not going to peak till June 8th.
June the 8th?
June 8th.
We can't all be sitting at home by June 8th and be employed with insurance, man.
Well, yeah, I know. But so my question is, well, where's the model? And all they do is show you a picture and they tell you where they got it. Well, you go there and you can't use the same model because you need to know their inputs. What are the input data you're putting in here? Because those are the things that need to be challenged. Are the inputs actually accurate? Now, if the county is saying June 8th, and the state is saying from the national thing is saying that the state peaked 4 days ago, where's the disconnect?
Yeah, that's it. Well, that's a huge disconnect.
Right. Now, of course, every subset in the state can have different information, but not 2 months. So today, when they were presenting the data, they said now is towards the end of June because we're doing so good with social distancing, we're moving the peak out. But keep in mind, where the peak is doesn't matter because we still got to get all the people through at the bottom.
So
remember the vaccination, when I'm talking about the theory of herd immunity.
Yes.
Okay. Just because the curve shifts out like this and flattens, you
Yep.
still got to get all these people through. They're
Right.
still going to go through. You're not, because the curve is never going to do this. Even if we had a vaccine, it wouldn't do this. And for the example we had, what was the number you said earlier for flu deaths this year? And we have a shot.
Well, in 2018, I think the flu deaths was 61,000 in the U.S.
Okay. And that's with a vaccine. So
Right.
we're never going to flatten it. It's just not going to happen. So anyone who thinks that's what's going to happen, go jump off a bridge. Because you're hurting society just by breathing. So I told you I was going to piss everybody off at one point in time. The reality, we're never going to flatten the curve. It's not possible.
Yeah, it's nowhere near getting this to zero.
Right. What we're trying to accomplish is how do we minimize the damage to the healthcare system so that we can reduce the death rate. That's what we're trying to accomplish. That's what matters, is the lives matter, but the collateral damage does too. So the county, and I'm using the county, but I have the same questions for the state, needs to be transparent with those data points. But the reality is, I don't give a flying hoot how many people get infected. It doesn't really matter. The only reason number of people infected matters at all is to let you know when you get to 70% of the population, so you know you have some level of herd immunity. What matters to us, what matters more than anything, is how many are in the hospital, how many of those are in ICU, how many hospital beds do you have, how many ICU beds do you have, and how many have died. Now, you could go much further into the death number and even these numbers, which, considering that we have a population of people as smart as we do, and we have a population of people who, we have an entire almost industry of people who now biohack, where like I'm keeping this data points, I'm tracking every single thing, but I also take my temperature every day, I weigh myself every day, I take my blood pressure every day, I do my SpO2 max every day. Yes, I do. I have a pulse ox. I've been doing this for years. I have this huge chart that tells you, I've been tracking this for years.
And this is why I love you, and I wanted to have you on the show, because I don't know if anybody listened and understood that. This dude weighs himself, takes his blood pressure, he takes his SpO2, which your pulse ox, every day.
That's how much oxygen is in your blood.
Yes. So when you go and they put a little thing on your finger and it says 97, 98, 99, 100, this dude is doing this shit every day. Every day. So when they look at him and go, well, John, how have you felt in the last month? John has an Excel spreadsheet that shows him.
Now it's in my iPhone, so Google has it. Because, once you put it in the cloud, everyone has access to it.
I don't do that shit.
But and I'm not anywhere near the level of what some people do. So we have this population of people who, like me, collect data and they compare it to actual literature. And you remember a couple of years ago when I was getting ready for an Ironman race, I dropped 40 pounds in like 30 days.
Yes.
There's not a diet that I followed. I literally took the data I had collected on my own biometrics and I compared it to what I knew worked and what I knew didn't work for me. And then I said, I'm going to do these set of things. And I only did a handful of things. And I was dropping weight. I mean, I literally went through a couple pant sizes. It got really expensive really quick. But the reality is we have this population. We need to release this information so our population can help us sort through it. Our population is basically equivalent to a supercomputer, if not better. Because you have people who are going to scrub and scrub and scrub and compare it to literature, and then they're going to pose questions that you're not going to want to answer because it doesn't meet your agenda. But the reality is you have people who can do this, and they're sitting at home bored. I think I finished watching Netflix the other day. Not like a show, the whole freaking thing. Okay?
The whole thing.
Yes. I mean, when I realized I was watching Barney, I knew it was over. No, not really. But the people are bored. They've been at home for a month now. Give it to them so they can actually dig through it.
So, John, if you let me ask you this: if you were in charge, what would you do starting tomorrow? If you were in charge of North Carolina, what would you tell? What would you do tomorrow?
Tomorrow?
Yep.
Realistically, first thing I would do is tell everybody, the first thing I would do is I would release some guidelines, some realistic guidelines to stratify yourself. This matters. We are unhealthy Americans. Trust me, I've got a beer belly here and I've got a beer right here to prove it. But the fact is, we need to stratify. Everyone needs to stratify so you know what your risk level is. And not so much your risk level, the risk level of the loved ones that you come in contact with. Because once you're stratified, if you stratify yourself with your mother that lives down the street and you want to follow her rules, great, you follow her rules. But you need to make sure the people you come in contact with every day, or you're going to come in contact with, you're using their stratification too. And the greater the most deadly stratification is the one you need to classify yourself as. Once I've done that, I would immediately let the people under age 40 that have no comorbidities, they have none of the risk factors, I would have those people out and about. But I would put one caveat. If you get sick, stay home for 14 days. Because although we want to build herd immunity, we don't need to be stupid about it. Because we also got to make sure we don't overwhelm the hospitals. And so if you're sick, running around on people, you're making it worse because you don't know which person is going to end up in the hospital. So you've got to get those people out. Now, in the event, you got to keep in mind that some kids that are in school, their parents are in their 40s. Well, guess what? Sorry, Pops. You don't have a school teacher. You're still at home. So when you go under 40, you've got roughly, I think I did the math earlier, around 30% of society when you take the parents who have kids out of that population, you end up closer to 20% of the population. So by doing under 40, you can have 20% of the population under 40, no comorbidities, and my comorbidity number, I just use national averages to pull it out. But you end up with this group of 20%. So you take 20% of society and you release them out. You want them to go out and get infected. You want them to build herd immunity. You want them to go home if they get sick so we don't overwhelm the hospitals. But we also know that 50 to 80 times the people who are symptomatic are non-symptomatic. So there's going to be people who don't get sick. We still don't know why. I have some theories. I've blown up a bunch of theories. But there's a common denominator between all these people who are getting sick, and we don't know what it is yet. But the severity of the sickness has to do with that common denominator. Some really bright genius, probably in third grade, is going to be looking at the data one day when he's supposed to be watching his teacher in school, and he's going to go, "Oh, there it is." But the reality is, we don't know what it is. But we want that population to go out and start getting infected. As long as 2 weeks into that experiment, because it's what it is, there's not a spike in hospitalizations. Now we release category 2, which are people under 40, or first group is under 40, people under 50 with no comorbidities. because you still are, with that population, stratified across, even with comorbidities, it's 1%, it's like 91%, is the highest in the males. That is including the group with comorbidities. It's included in that. That's not strictly people, 100% people with nothing. So I would push that group out 2 weeks later. One more time, the same rules apply. Now, at the end of that group, I would change the rules of the game. Now we're moving into a little bit riskier categories. And at this point in time, I would implement a mask policy.
Now,
I want to get as many people infected as possible initially, but only the people who are not going to get sick and die. That's why below 50 with no comorbidities are the ones I would do that with. Some of those people are going to get sick, and some of them are going to end up in the hospital, and I hate it for them. I really do, but it's for the greater good. But the reality is, if we don't overrun the healthcare system, they're probably not going to be any die in those first two groups. Unless there is the occasional, there was a guy in his 30s who passed away from it. They thought he had no health conditions, but they found out after he passed away that he had undiagnosed leukemia. Unfortunately, those are going to be the ones that we don't find out, and there's just no way to help with that. But it's for the greater good. You need to protect the people who can't protect themselves, and to do that, you have to surround them with people who have immunity. And now I would make the groups that we release much smaller. I would move them into 5-year age groups versus 10-year age groups that we started with. Well, the first group we did 40 years. The next group we did 10 years. Now we go down to 5 years. And then I would do, and it's still in these 2-week increments. And we've implemented a mask policy, and we've gone down to smaller groups because we're trying to mitigate risk, because that's what's important here. And when you go to mitigate the risk, and I'm not a rocket scientist or an epidemiologist or anything else, I'm just using plain common sense here. So you want to put in risk mitigation factors when you start to get to higher risk populations. Now, as you go through this, you slowly but surely, you get to a point where you get past 70% of the society who is been infected and has gotten through it and has immunity. More importantly, what happens is, and this was done in the past with other viruses in the past, more importantly, the younger age group who are not going to have problems, they build antibodies. We've all seen it on the news, people who've been sick and coming in and volunteering to give plasma, so the antibodies.
Yeah.
We can do that here by getting our young people sick. But we stratify our approach. Keep in mind that the workforce, the labor force, not the people who have office jobs, the labor force is people 20 to 40 usually.
Yeah.
So we now have manufacturing jobs to manufacture masks. We now have people cooking. We now have restaurants open. We have bars open. Bars and restaurants, they have a very important role in our society.
100%.
We're connecting right now through Zoom, but it's not the same thing.
Right.
There is a reason to go hang out with your buddy, punch him in the shoulder, so you don't go home punch your wife in the shoulder. I mean, there's a reason these third places exist in our life. Whether your third place is Starbucks, where you go sit and listen to the funky music while you're playing on your computer, or your third place is a bar, a third place is not your home, not your work, a third place that you can go and release steam.
Sure.
And we have to get people back to those. And once we've done these steps, we've gotten past that critical threshold of 70%. And that's not a magic number. It's just where you start really achieving herd immunity. The higher the percentage you get, the much higher level of immunity you have. But once you get there, you can now start to really tackle the virus. in very, very specific groups. Now we want our diabetics under 40. And we know that population is only 1 million across the country. I don't know what it is, but you know this because and then we know that we have a possibility of a million people hitting the system, except the stratify in that group takes it down to we're only going to have 10% of them hit the system. That's 100,000 people across the country.
Yeah.
So we can stratify and we can really start doing things to get us back to work. But right now we have truck drivers. And I don't know if you've been to the grocery store. I go every day just out of protest for these stupid rules because it's an essential business. And I just happen to go to Whole Foods and Harris Teeter. I go to Walgreens too because that's essential. And usually at least once or twice a week I go to the hardware store because I think the rules are stupid. Because when they first went into place, I somewhat respected them. But once we got new data, when we did not adjust fire, we started causing problems. There are people dying today because of the stay-at-home order. That's the problem. So when you start going down this path, you can start fixing these problems. But if you go to the grocery store, do I have that? Let me see if I have that spreadsheet. I went to the grocery store. I went to all the grocery stores. Do I have it?
You have a spreadsheet of the
I have to pull it up later. No. So what I did is over a period of 2 weeks, I counted every customer and employee I saw in the grocery store, Home Depot, or not Home Depot, because I don't go to Home Depot, I go to Lowe's. To Lowe's, Harris Teeter, Whole Foods, Walgreens, and Black Hawk I'll wear once or twice. I counted every single person in there, and I put them into categories. They were either an employee or not an employee. They were either appeared over 65 or under 65, and they appeared overweight or they appeared healthy.
And you kept this data. You recorded this data.
I recorded this data for 2 weeks.
Do you people hear me? Do you hear him? This is what I'm talking about. Go ahead, John. Sorry.
The people in these stores working are not the people we need working. I literally had a guy at the hardware store with a cane because he's so old and he's obese, walking me to get a screw. Okay? I'm very thankful for him, and he helps me every time I go there, but I don't want the man to die. He doesn't need to be there.
Right.
And that job can be filled, at least temporarily, by a 20-year-old.
That's a good point.
They may not be able to help me find the screw I need, but at least they can fill the job. And that guy who has been helping me for years doesn't die, and he can help me next year.
Good point.
So we need these younger people out in the workforce. And we need these other places open. And we need jobs. Because that New York Post article you read tells you that for every point of unemployment we have, there's a certain percentage of increase in suicides. At what point, and my friend who killed himself, he was overwhelmed.
Yeah.
He didn't have any pre-knowledge of this. He just didn't see, he had to let all of his employees go. And he didn't see another way out. Because no matter what kind of stimulus they gave, it wasn't going to be able to hold him until June.
Right.
Which Mecklenburg County is talking about. And although that may not be realistic, they may not stay that long, but that's the cards they're showing. And as a leader, you're supposed to be helping people stay calm. No, they're spreading fear. They're spreading panic. What they're doing is a definition of terrorist. They're spreading terrorism to get people to do certain actions.
Right.
They are domestic terrorists against the Constitution.
Did you have a chance to check out the YouTube documentary I sent you, Out of Shadow?
No, I haven't watched it yet. I watched the intro, but...
Right. Well, check it out. You will not be disappointed, and it's going to fall right into what you just said, man. And someone like yourself probably knows a lot of this stuff, but it opens your eyes, and it's another one of those things where you just question.
But here's the real harm in what just happened. So, do I think Governor Cooper? Well, let me first of all give you a whole other thing that just happened today that you may not be aware of.
Probably not.
Governor Cooper petitioned the Board of Elections so that in a state of emergency, we can have mail-in ballots in North Carolina.
Mail-in ballots?
Mail-in ballots. Why does this matter? Because he has the power to declare state of emergency. So if he thinks he's about to lose the election and he thinks he can get a better turnout from mail-in ballots, he can declare a state of emergency because of a flea outbreak, and we now are on mail-in ballots, and he wins the election again.
So that brings me to something I wanted to talk about. So during this pandemic, is there going to be an election? Can there be an election?
There has to be an election. And if there's not an election, and this is very important, if there's not an election.
I'm talking about the President of the United States.
Yes. I am too. No matter if there's an election or not, Trump will not be the president as of noon in January.
Who will be the president?
If we don't have an election, there's a process. We have processes in this country. So if the president's not there, it's the vice president. But there was no election, so the vice president's out as of noon on January 20th. Goes to the Speaker of the House. Except if we don't have an election, we didn't elect Congress, and Congress gets reelected every 2 years. So there's no Speaker of the House. It ends up going to the oldest member of the Senate majority is who it would fall to. That's not Mitch McConnell, but there is a Republican that is the oldest member. Now,
what? So wait a minute. So who is the oldest member of the Senate that is not Mitch McConnell?
I'd have to look it up. I did all this earlier, and I did all this work earlier, and then I did all the math and figured all this crazy stuff out, and then I found a YouTube video that actually told all this stuff much better than I could ever tell it, which really just pissed me off. But
here's the thing: we're talking about something that 2 months ago was hypothetical, but now it's real. It could be real.
It could be. But there's a whole other gambit here that you have to keep in mind. We don't elect a president.
All right. What do you mean?
The founders of this country were so smart that they realized that there may be a time. Keep in mind, we've had wars before, we had pandemics before, and we still voted. But the founders of this company were so smart that there may be a time when we can't get to the polls.
Yeah.
They built a solution into the problem. It's called the Electoral College. We go to vote to tell our Electoral College members how to vote.
Right.
The Electoral College can still go vote for a president even if we don't have an election.
I'm lost. I'm not that smart, John. I'm lost.
Basically, in theory, I don't know if it's ever happened. In theory, the Electoral College could go vote the way they think their districts would have voted.
So by saying that, you would say the Electoral College from 2016 would all vote. Well, Trump would win again.
Not necessarily.
How in the hell?
Because you have to keep in mind you're going against a different candidate. Because part of the people voted for Trump just because they didn't like Hillary. I personally wrote my own goddamn name in because I didn't like either one of them. So I thought Hillary was a criminal. I thought he was a lunatic. But the reality is they would have to take what they think that they're not constituents, but their people would vote. Would they vote for Biden or would they vote for Trump? And they have to go cast their votes based off of their feeling of the people they represent. And there's some level of understanding of how that could work. I mean, all the California Electoral College members are going to go for the Democrat. There's certain states. There's certain states that are going to go for Trump. Because we have red states and blue states. It all comes down to these swing states. And these Electoral College members in the swing states, what they can do is they can really kind of make a judgment call based off of the turnout on the primaries of how passionate the population is. There's all kinds of different ways that they could come up. This would never happen, but this could happen.
Shit, I didn't think we'd be here today. If you'd asked me on January the 20th if we'd be here today, I would have told you no.
Right.
So,
The other thing that could play out is that the governors, because 1/3 of the senators are always up for re-election.
right.
Now, in the last election, if I think it was 2 more seats, might have been 3 more seats. 2 or 3 more seats would have been won by the Republicans. They would have maintained the majority through the next entire presidency.
Right.
But they didn't get those 2 to 3 seats. So there is a chance the Republicans could lose the majority. And here comes the chance. We have 2 Republican senators from the state of North Carolina. One of them was up for re-election, I think Tom Tillis.
Yep.
But in the event that there's not an election, the governor can appoint the senator. Do you really think Roy Cooper will appoint a Republican?
Not
So
a snowball's chance in hell.
So the Senate could swing to the Democrats, at which point in time you end up with a completely different answer. And I think a different answer of who would end up is the oldest person from the party. And you have to assume based on the people there, but it could also be somebody who gets appointed by governor.
This is crazy.
So this will never happen. What we've got to worry about now, more importantly than anything, is the election's going to happen. I'm not that worried about that. I don't think anybody we have right now is got ill intent enough, except for the guy in Virginia trying to take people's guns away, has enough ill intent to do anything harmful. They're really, I think, trying to do the right thing. And I think that they're not looking at the data and not adjusting fire. And in the world of artillery, you shoot downrange. You miss, and you have a forward observer that says, "Oh, you need to come 2 clicks back." You shoot again, you're 2 clicks back. Oh, you undershot. Now you need to go 1 click out. You shoot a third time, you adjust fire based off of your results. We haven't done that. If you go into the scientific theory, there's a hypothesis, there's an experiment, there's an observation, there's a conclusion. You go back and you redo it over and over again until you get to what you want. Either way you want to do it, you're not there. So that's a problem we're doing. But they have good intent. They really do. Governor Cooper is a freaking idiot. But I think he has good intent. And I think the people in Mecklenburg have good intent, but they're beyond idiots. They don't realize that they have the most money in the city, or in their county. There's more money in their county through GDP than anywhere else in the state. And yet there are businesses right now looking to move to South Carolina for no other reason than South Carolina opens up tomorrow at noon.
Really?
Yes. Not all businesses, but they're starting their process. Department stores will be open tomorrow at noon.
Damn.
The beach is open tomorrow at noon. So we now have businesses. Keep in mind, 50% of our economic power in this country are small businesses.
Right.
As businesses outside of restaurants and bars can pick up, especially in Charlotte, where you're 6 miles from the border, you can pick up and move across the border in next week.
Right.
And I have a friend who's a commercial real estate agent in South Carolina who has told me his phone's been ringing off the hook for the past week because it's people in Charlotte who have heard that Charlotte's going to stay closed till the middle of June, and they want to move their business down to South Carolina. And so you got these people, the real estate market, commercial real estate market in South Carolina is going to pop.
Right.
Because you also have a bunch of people wanting to move. And these are small businesses, 10, 15, 20 employees. I mean, my company, we have there are less than 20 of us. And we could up and move if we wanted to.
Sure.
And all of that is tax revenue leaving the state.
Right.
Because some people, if we picked up and moved to South Carolina, do you really think I'd still live in Charlotte? The income taxes are lower in South Carolina. The gas taxes are lower in South Carolina. everything's lower. So I would, of course, I'd move. That I drive 4 miles to work every day. I kind of like that.
But you can also drive 20 miles and save a shit ton. Well, yeah, you would just move.
I would just move.
And you might even get a tax break incentive.
I would get a tax break because I've done the math. I'd pay 9% less in taxes a year when you take into consideration the electricity tax, the phone tax, your gas tax, your income tax. It's significantly cheaper. So it's not cheaper when I have to drive from South Carolina to Charlotte because now I have gas I have to pay for. But so we're hurting our economy in North Carolina by keeping things closed when the state next to us isn't.
Right.
But the problem isn't Roy Cooper. The problem is Adolph Jones, whoever's the governor 2 years from now, 3 years from now, 10 years from now. I just use Adolf because it's Adolf Hitler's first name. I just didn't want to use the whole name. It's the guy who has ill intent.
Yeah.
Goes into office. And the way the law works in this country is it's built on precedences. So if this was accepted here, we could do this again.
Well, for sure.
Which means this new Governor Jones comes in and says, I'm going to suspend the election and I'm going to pick the senator because of a state of emergency. I don't think you guys should be going to church because I'm Muslim. So I think we're gonna do an executive order so that your right to go to church is suspended.
That would be an extreme case. And what you're saying, it could be 5, 10, 20, 30 years down the road. Who knows?
But we're laying the groundwork now to tear America apart.
Right.
Now, you do have movements like Reopen North Carolina, who will be protesting tomorrow in Raleigh. And Congressman Dan Bishop is actually going to be joining that protest tomorrow. He's in I'm in his territory, and he has now have a voter for life. Just the fact that he is actually getting out there to show whether I believe we should reopen or not doesn't matter. He's not sitting in a chair in Washington,
right,
doing nothing. He is actually hitting the streets with the people that he believes in, that he believes the same thing, exercising his God-given right that he has because of the Constitution of the United States. And personally, the officer who arrested that lady in Raleigh, I think should be suspended because he took an oath to protect the Constitution as part of his oath to become a police officer. And when he arrested her for protesting, he violated his oath of being an officer. There has to be lines. We have laws for a reason. If you don't enforce the laws, Sherman's March will happen again, just in a different way.
Well, John, I got to tell you, man, I think that's a good point. I think it's a good stopping point. But but that's why I wanted to have you on, because from the beginning, you give thought-provoking ideas, thought-provoking questions, and you make a good point. Not everyone's going to agree with them, but that's the point of this. This is why it's called the appetite for discussion, because we can have controversial or difference of opinions, and it just leads people to walk away and go, haven't thought about that. Or that's a good point. Or this guy might be horseshoe bat crazy.
And that's probably the answer.
Which is totally fine. I thank you for coming on. I appreciate you. If you want to send me a couple articles for people to look at or things that you've quoted tonight, send it to me. I'll put in the YouTube link tomorrow or whenever I publish this, or whenever you send it to me, it's fine. And do you want people to follow you on Twitter or anything like that? How can they find you?
They can follow me if they want. What is my Twitter? Just know I'm on there ranting every day. At least right now I am. And I'm right. Oh, and I'm not on Facebook. I'm killing Facebook, by the way. And it has more to do with the Constitution as well. Zuckerberg came out today that they're going to be killing accounts that are protesting the stay-at-home.
No way.
Yes. So if you have a Facebook account, I strongly encourage you to consider getting rid of it because Facebook is now censoring Americans.
Damn. And this guy right here lets you know what's going on. The heartbeat of under the mainstream media.
And we'll go one step further, and this is my fear of what's going to happen here in the near future. We have groups of protesters out there. We have people protesting we need to open the country up. We have people protesting. We have healthcare workers out there in healthcare in their scrubs and their mask saying, one guy blocking traffic. By the way, that's obstruction of the flow of traffic. They should have arrested him. But if I was out there protesting and there was a guy in scrubs and a mask saying I should stay at home, I would have gotten out of my car and walked up and given him a hug. Because if he thinks that we need to stay at home because we're that contagious, he should not be out there. But that's not the problem you have. The problem you have is what you saw in Michigan and what happened in Pittsburgh today. What happened in Wisconsin? What's going to happen in every major capital in this country? These protests are going to start becoming protesters with guns. It's only going to take a spark before we see bloodshed. And COVID is going to be minor. Because once we have a spark like that, it becomes very bad, very fast. And we have to figure out how, as a country, not just on this issue, but every other issue, to talk to each other. I could have sat here for the past however long we've been on here and argued the same topic, saying that we need to stay at home. And giving you just as compelling thoughts. But we carried on a conversation.
Right.
It can't be all or nothing. We learned in elementary school how to compromise and how to play with each other. We need to start learning how to play with each other again.
Right. Well, I think you have a good point about that. I hope you're wrong, but I would like to say thank you to all of the healthcare workers, first responders, firemen, ER doctors, ICU nurses, anesthesiologists, anyone who is fighting the good fight against coronavirus and everything else every day. And we appreciate everyone for listening tonight. If you haven't done it yet, do so. Subscribe, like this channel, and subscribe to the podcast. I'd like to thank you to Hunk of Junk Calling. One call removes it all. Also to States Vegas Clothing Company for providing me with all my swag this year. Casey Tate at Farm Bureau Insurance. And to Integrity Securities for all of your alarm security needs. John, how can the fine folks find you on the Twitter?
I'm on the Twitter at JDMCLEAN.
Boom. Thank you, John. Appreciate it. I will definitely have you back. You may be my new Alex Jones.
I don't know who that is, but I can debate you on any topic.
I love it. Thank you, John.
I appreciate it. To prepare. Okay,
thank you, guys. Talk to you again soon. Bye, everybody.